The National Association of Resident Doctors on Wednesday began indefinite nationwide strike to demand immediate payment of 2023 Medical Residency Training Fund, among other demands. Nard President Dr. Emeka Orji said the action followed several ultimatums, appeals and engagements with government and demand of the association still not met. Nuel Samson, however, reports that doctors attend to patients at the National Hospital despite commencement of the action.
The strike may likely affect patients on admission in the hospitals, but at the National Hospital Abuja, some doctors are attending to patients. Head of Department, Information Protocol Management of the hospital, Tayo Hastrop, says patients are attended to in the hospital even though resident doctors have commenced indefinite strike.
We have other sections of the hospital working. We have our nurses, our consultants, the senior doctors. They are also on ground. The point is that these are the younger ones that are supposed to support them, but they're not there. That means the rate of what they can do will also be reduced, but the laboratory is there. Our patients in the wards, they are also there in the wards. We are seeing them. Nurses are also attending to patients who they expect to nurse at in the wards. The house officers, we call some doctors house officers, they are for 1 year in any hospital, training for 1 year. All the house officers are on ground. They are not member of Nard, and so they are not on strike. They are also working to see their patients. So that means the doctors who are coppers, that means the doctors who are house officers, that they won't be on ground to support the consultants.
Some patients who came to the hospital for treatment or consultation speak on the doctors' strike.
We came in here, in fact, we were not even aware that there is strike. It was when we came around that one of the personnel told us that the doctors were not on ground, that there has been a strike. So when we came in, the hospital is scanty because the number of patients they register per day, I think they do take up to like 60. But looking at the issue on ground, the patients are scanty. And they are not even, I think there are 2 doctors on ground. And we've been here for an hour up to now. We have not been attended to. I hope they will attend to us.
I came in this morning and I was attended to by the nurses and the doctors. I'm waiting for my test. They were able to attend to me smoothly.
The only thing on the lips of these patients is passionate appeal for the government and the National Association of Resident Doctors to come to the negotiation table and resolve their differences. Nuel, Samson, Trust TV News, Abuja.
The Zamfara State branch of the National Association of Resident Doctors on Wednesday joined their counterparts nationwide to embark on an indefinite strike to press home their demands. The State Secretary of the association, Ibrahim Dauran, said the association or the action became necessary due to the federal government's failure to honor agreements and refusal to meet their demands. The report.
According to Dauran, among the pending issues that provoked the indefinite strike are non-payment of hazard allowance, residency training fund, and improved manpower. Dauran explained that the resident doctors have empathy for the patients on what they will go through during the period of the strike, but have no option than to take this painful decision to go on strike because of the government's insincerity to keep to the agreements reached by them. He noted that the association had invested time deliberating with government to get them to implement the agreement, but all effort proved abortive as the government kept giving them false hope.
It's a painful decision actually, very sad. We consider our patient first. Our own responsibility is to serve humanities. We have given time with a lot of hope that we have been receiving from the people in charge. As you have gone around the center, you have seen some doctors working, but at exactly 12 noon, nobody is going to work. All of them, we have a strike monitoring committee that is going to go around. And as I've said it, our motto is to serve humanity. The action has been taken. When we look at it, we cannot just go like that and shut down everything. Our patient will have the critical and the stable one. We give a timeline to 12 noon today so that all doctors will hand over liabilities of the patient to the respective authority concerned.
Dauran appealed to the government to place premium on the lives of the masses and consider what patients would go through as they shut down medical services in the hospital to compel the government to do the needful regarding their demands.